Hi everyone. I'm Lisa Dewey. I am one of the advisors based in the RSS at the University of Southampton, and I'm going to talk today about aims and objectives and trying to get that right in the application that you might be putting together. Today we're going to talk about the research question, then how you might turn that into your title, and then also how you think about your aims and objectives in your project. First of all, we're going to start by talking about how do you come up with a good research question? How do you convince a funder that this is something they want to put money towards? So, things that are worthwhile thinking about is looking at the criteria which the funder is going to use to judge your application, and then also thinking about how clearly you can articulate that research question that you want to do. It's ideal if you can do it in a single sentence. It really has to be understandable to people outside whatever area you're working in, because most funding committees are made up of a really broad range of people with different backgrounds, and they may not understand the ins and outs of everything which you think about every single day. So let's think about NIHR, and let's think about some of the things which NIHR think about when they are looking at applications for funding. So these are all things you need to think about to write the application form. And you need to be able to probably answer all of these questions in detail so that you can make your application competitive for funding. So they're going to want to see things like how bad is the problem that your research is going to answer the question for. What don't we know yet about this particular area, and how might what you do actually help answer some of these questions and uncertainties in this area? How will your idea make a noticeable change? How you measure it? And is there anyone else out there who thinks we need to do research in this field who can put weight behind your application? That's not saying it has to be part of the application, but it's how you evidence that within the application. Trying to think about who else is interested in research in this field can be really helpful. So every funder has got their own particular criteria which they want to see in applications. So these are the NIHR funding programs. I think here probably most relevant are the I for I program, and also the EMI program, and also the HDA program have both got lots of experience of working with SMEs and bringing forward technologies. So they would be probably the most interest bits of NIHR, I for I at the top, and then EMI and HDA secondary. So look at their websites, they will have their own guidance around things they're looking for in applications. Make sure you answer anything they put in their guidance notes. These are the things that the funding committee are expecting to see, and structure it in exactly the way they say in their guidance notes, because you don't want your application to stand out for all the wrong reasons because you haven't got the right heading that everyone else has got. So pay a lot of attention to that. It just helps structure your application the same way that everyone else is. So let's think about the need for evidence. So what do we mean by this? So we think, how bad is the problem? So by this we mean the scale and the impact of the area you're thinking to look at. So does it affect a lot of people? Or is it a rare disease that affects a small number of people, but they have very considerable needs following on from that? Does it cost the NHS a lot of money? Does it cost social care a lot of money? This is the sort of basic information that's really helpful at the start of your background section, just to orientate readers to why this piece of research is so important, because it's going to impact on all these people or the NHS in a particular way. Thinking about the need for evidence. So look at the literature. What do we know? What don't we know? What's the gap you identified? Um, and explain that in a clear way, which someone outside the field might not would be able to understand because they don't know the ins and outs of it. Um, are you going to be targeting a particular large section of the population which is affected by this problem? So what will the noticeable changes be to people who have got this condition, or to people outside the field once this is funded? Are we going to see big changes in large numbers of people, or big changes in small numbers of people with rare disease? But just stating that evidence is really important. And then looking about who else might be calling for information in this field. So, for example, looking out there at the NHS, so NHS England publishes things called demand signalling things. They say when they particularly want need. Um, Also thinking about things like the NHS 10-year plan, referencing that's really important. That comes up a lot. So, does your research target a particular shift within there? Looking at the Royal Colleges, so for example, the Royal College of Physicians, the Royal College of Nursing, yeah, have they put out research needs which you could reference in your application? Look at charities, getting charities on board is really important. Are they calling for work in this area? And also looking at NICE, so NICE publish research evidence gaps in all of their guidance. So look at those, see if there's a particular need highlighted in one of those. Then I've also got here the James Lind Alliance. This is a organisation which brings together people from um, broad ranges of backgrounds, so members of the public, people with the condition, and researchers and clinicians, and they go about setting around where the uncertainties are in this particular field, and they have a list of top 10 uncertainties published on the James Lind Alliance and all the different areas which they've done prior to setting partnerships in, and you can look at those and they're freely available, and you can also go and speak to people who've been involved in setting those uncertainties, and that can be really helpful in just getting some more people on board with your idea. So I thought I'd talk through a bit of an example just to see where you might consider these things when putting an application together. So I'm going to talk about stroke. So I'm going to set the scene a bit. So there are 100,000 people in the UK every year that have a stroke. And up to 60% of stroke survivors experience some form of cognitive impairment within the first year. The prevalence is between 20 and 80% depending on a particular population criteria. And this loss of cognitive function makes it really difficult for individuals to perform everyday tasks. So this can be getting dressed or preparing food. It's estimated that stroke costs society 25.6 billion a year, including 8.6 billion in NHS costs, and it's forecasted to grow. We know that rehabilitation helps people, it does help people recover that cognitive function they've lost, but we know rehab support is limited and it has varying practice across the UK as to how it's implemented. So that's me setting the scene, that's telling you the big problem that where money is being spent in the NHS and that we know rehab helps, but we also aren't delivering it in a way because of restrictions on cost and on resources. So that's me setting the scene. So then I've got a great idea. I'm going to say I took this idea from several published studies on the Eye4Eye website. They are freely available. But I'm going to talk through that now. So the idea is to use virtual reality. So we know that virtual reality has been used in lots of other fields before. So it's used in medical training, it's used in people flying aircrafts. It's a way to train people to do new things in a safe environment. So the idea is, could virtual reality be used to support stroke rehab? And to develop this as an idea, I need to think about how I might take that forward. So I'm going to talk to patients and carers to see if it's helpful from their point of view. Would they be interested in using virtual reality? Could it help them recover? That's where I'm going to start to see if there's interest in that idea. Um, then going to look at all the other organisations I talked about. So I know that NHS England have published a national document called the National Stroke Programme Research Demand Signalling, and that document identified a lot of areas for research. And one of the areas identified was what's the most effective way to deliver stroke rehabilitation. Tick, NHS England is also interested. I'm then going to look at the James Lind Alliance, and there is a James Lind Alliance PSP on stroke. And one of the key uncertainties identified by them was more research is needed to understand how to rehabilitate and support people affected by stroke with cognitive difficulties. Tick, James Lind Alliance is also really interested. So they're two really big national groups who are saying that there's a need for research in this area. I'm then going to go and talk to clinicians to see if they would be supportive of this idea. And yes, they have told me, along with their patients, that patients want to become more independent and to regain their skills and be really happy to use VR to support their rehab. once they've been home and back from hospital. So everyone is really interested in my idea to use virtual reality. So it feels like I'm onto a bit of a winner. So I'm going to continue to work up this idea. So in answer to those first questions I asked right at the start, so how bad is the problem? So we can see that stroke is a really big problem. It affects a large number of people and it costs the NHS a lot of money. So I can outline that in my application. We can also say that we know virtual reality has been used in lots of other areas. So it's been used to train medical students to do techniques in a safe environment. It's used to train new pilots to fly new planes. So it's got precedence to be used in lots of places to do things in a safe environment. What we don't know is whether we can use this to help people regain cognitive function after stroke. So that's our uncertainty, and that's what we're trying to answer the question to do. Um, so how might this work? So we know that we can use virtual reality to help people do tasks. We wonder whether using virtual reality in people who've had a stroke could help them to recover cognitive function by breaking down larger tasks into small manageable chunks, and they can do that in a virtual reality environment where it's safe and they're going to come to no harm. What notable change might we make? Well, there's a lot of strokes every year, as we outlined in how bad the problem is. So this has the real potential to make an important difference to people recovering from stroke. We also know rehab services are stretched and can't deliver the service they want to do. So this could actually fall into place where after someone's seen those initial face-to-face consultations, and they could use virtual reality to help them to recover. Who's calling for this work? Well, we've got professional bodies, we've got clinicians, we've got patients, everyone's bought in, everyone thinks it's a great idea. So it feels like it's a really good um, point to start an application from. So let's think about how we're going to start to phrase that in a research question. So what we want to know is basically, can we use virtual reality to help rehabilitation of stroke patients? So let's think about how we could refine that and make it a bit clearer so it's really clear what we want to do to people reading the application. So let's change it to, can we use virtual reality to improve rehabilitation of stroke patients? We're adding the word improve there to show that we're trying to do, but we're not just trying to improve rehab generally, we're trying to improve cognitive rehabilitation. I've added the word cognitive in there. And then just to help explain further, I've said, can we use virtual reality to improve cognition, rehabilitation of stroke patients and reduce supervision? Because that brings into that saving NHS money and helping to improve rehabilitation of patients because we know that the services are stretched. So we can reduce supervision, which will free up NHS resources and time. And then also added on the end and support return to independence because that's what we heard from stroke patients. They wanted to improve their independence and regain some loss of function. So that just brings in the patient perspective into that research question. So that's kind of a refinement, and it also starts to talk about potential outcome measures. So an outcome measure could be, can a patient make their cup of tea independently. So it starts to talk about how we might be able to think about how we could measure outcomes. And the process that we went through to do that was use a PICO formula. I don't know if people have heard about that, but it's a thing that NIHR use a lot. So it's just defining any project which you want to do in a population. So that's the people affected by stroke who also have cognitive effects of stroke. An intervention is the eye, so that's our virtual reality intervention. Our comparator would end up being usual care, which is variable, the standard rehab that we use for patients at the moment. And then outcomes is a reduction in supervision. So that could be fewer visits from an OT or a physio. And they also want to see increases in independence. That could be a measure of how independent they are making tea or making their own food or getting dressed, and then also increasing task complexity. So they're what we're going to measure as outcome measures to see if our virtual realities had an impact. I know that PICO is not relevant for lots of people. There are lots of others out there. I've only just used PICO because it's the most common one used by NHR. If you want to use a different one, search the internet. There are lots more out there and it might be more relevant to the stage of development you are for your particular application. Thinking about how to make this into an aim so it's got exactly the same elements you might use in a research question. You probably don't need to have a research question in A, you probably just have one or the other. You just choose what's relevant for you and also check what the funder asks. But just turn that from a question, into a statement. So this is a project to investigate the use of virtual reality to support cognition rehabilitation following a stroke. So it explains exactly what we're doing, but it's not in a question format. Um, and then thinking about aims and objectives. So objectives break down how we're going to achieve our aim. So you need to make sure any language is appropriate to the aim. So if it's a feasibility study, don't talk about effectiveness outcomes. If it's qualitative, use words like explore, understand. If it's quantitative, use words like assess or measure. Um, and that can just start to add the detail to what you want to do. And then you can expand on that more and more once you get into the main bit of the application. So keep this fairly short, fairly concise. It's just a way to orientate the reader around, this is what you're going to do, this is how you're going to go about it. And then the detailed methodology will come into that rest of the application further down. Um, So objectives about priming the reader for the big parts of the studies I just sort of mentioned. So don't mention stuff that's not relevant up there, but do mention things that are relevant. So if you've got like a nested qualitative component of the study, really important to mention that up front rather than mention it later down as a bit of a shock to the reader when they think they've got an idea of your study and later on you say, oh, I'm going to go and talk to 50 patients that they hadn't quite captured that. So make sure anything major is up in those aims so the reader knows exactly what's going to be happening. Um, so if I was thinking about objectives for this study, I think I might put stuff like refine the virtual reality environment with patients and clinical staff. Refine the virtual reality environment when using the low-cost transferable headsets with patients and clinical staff. Explore acceptability and feasibility of using virtual reality amongst patients and clinicians, and maybe explore some barriers and facilitators to using virtual reality. They're just some ideas, they're not set in stone, I'm just trying to uh, detail some out as what might be relevant for this particular study. Um, So what we suggest you do when you're writing an application to NIHR is have one aim, a small number of objectives. Don't overload the reader, but provide a clear signal to what to come. You do not want to have a surprise reader when they get down to page 3 of your page 5 of your 5-page overview to suddenly hear a new bit of your study coming in. So just use this bit to make sure the reader knows exactly what's coming. It helps provide a structure for the project plan. If you structure it in this way, it can be really easy for the reader to follow through. And I've mentioned a couple of times, but the funding committee that look at this application probably won't be experts in your field. So you want to make it as easy as possible for them to understand your area when they might not think about stroke every day. Their everyday bread and butter might be thinking about childbirth or something like that. So you just need to make sure that it's really clear for people outside the field. And then lastly, project title. So be descriptive and concise, make sure it captures the key components. Don't go into key technical phrases, don't use abbreviations unless they're well known. Don't make it long. It's supposed to be quick and easy to read and give the reader an idea of what's coming up. So for this study, I'd suggest something like investigating the use of virtual reality to improve cognitive rehabilitation following a stroke. It just gives a flavour for what's going to come further down the application. I know lots of people like to have some sort of acronym made out their title. You don't need to have that. So don't worry about making sure you've got one of those. Just make the title descriptive and relevant to your project. So in summary, make sure you've got a single research question or aim, make sure it's really clear and really watertight. Spend some time crafting your objectives because they lay out how you're going to achieve your aim, and think about your title carefully. It is the face of the application and the first thing that people are going to read. And then I've got some links here to various resources that may be helpful when you're putting your application together.